Oh, there we go. Hello, hello, hello. Yes, it is Friday. I feel like I haven't said that in a long time, but today is Friday. Yes, I'm Dr. Joy Fremont, Miss Dr. Ladies Tips for Your Teeth. I'm coming to you live right here in Hateville, Georgia. I feel like I have been missing you guys. I know I normally come in on Fridays. Sometimes lately I've been coming on like more and more, but I'm back. Did y'all miss me? If you did, just say so. Even if you didn't miss me, just say so, okay? I see Janine Carter still celebrating her birthday. All right, well, today I'm going to give you a few updates because we here in Hateville at Freemont Dental, we are going to be reopening on next week. Now, as I've said before several times, I have been coming to the office every single day. My car only goes from my house to the office and back. That's all I've been doing. I still have been observing, limiting my movement as much as possible. I'm really going to encourage you to do the same. But as I've been here, I have been fielding calls, doing tons of virtual consultations and examinations on Zoom every single day, it seems. So we definitely are going to get back to seeing you live and live in color, but I think we probably will still keep some of the virtual consults going because if you're not leaving the house, you got to get some treatment, right? So Andrea Banks says she'll see me on Tuesday. Oh boy, let's get ready, okay? But I'm going to do this in a two-part series because I want to give you some information and some insight on what changes are going to come when you come visit Freemont Dental, okay? Nothing's going to hurt your feelings at all, but I definitely want you to be ready for what to expect. Now, if you're watching this or if you're on live, say hey to me, please. Just say live or say hey. If you are watching the replays, please say replay. It's very important that I get this information to you. As you have appointments coming up, you're going to get emails and texts from us, as you always have been, to inform you of what to expect, because we don't want you to get here and be surprised. You know how it is, okay? So if you get an email or a text from us, please read that information, okay? It's very important. And we're going to try to consistently remind you of these changes that are going on, okay? Hey, CC, outstanding. So here we go. The first thing I want you to understand is that when you come to your appointment, it is your appointment. If you are used to bringing family members with you, if you're used to having your boo come with you, if your kids always come, that's not possible anymore. Only the patient who is having treatment will be allowed in the office. And I do mean in the office, not even to sit in the waiting room. We're limiting the amount of people who are here. Hey, Miss Emery. So make sure that if you're coming, now if the patient is a child and you're the guardian, you are allowed to come in and check them in. We understand that. But our waiting room, if you come in and see it now, there are only now 1, 2, 3, 4, 5 chairs. We used to have like 12. Okay, so make sure you understand your guests, your friends, or your family members will not even be allowed to come in. So I'm not trying to be mean. We're just following the rules that are set forth by us, for us to give to you, okay? So first thing first, come by yourself if at all possible, or have your friends, family members, whatever, wait in the car because they would not be allowed to enter into the building unless they are also receiving treatment. Also, when you come to the office, please wear a mask or a face covering. All people who come into the building are asked to wear a face mask or a face covering, okay? Don't come to the office assuming I'm going to give you one. Y'all know how I roll. I done told y'all to wear it. Don't test me. Don't test me. They already told you to wear it in public, so just wear your little public mask on up in here, okay? Wear your face mask or face covering when you enter the building. And when you enter the building, we're going to ask you to go ahead and wash your hands. We have a restroom right immediately at the front door, and you know you've seen it when you come to my office. Don't be offended. It's not personal. You will be washing your hands when you come to the front door. And then we're going to whisk you over into our private consultation room where we're going to take your temperature. We do have touchless thermometers, so make sure, hey, Dr. Carter, make sure that you know you're going to get this checked. If you know you're not going to do it, just, this is like going to be very, very common when you go to places now, okay? So make sure you understand it's not just Dr. Freemont who's doing it, all right? So these are some changes. I'm just going to give you a heads up because I like you like that, okay? We're going to take your temperature. Once we get past all that, then you're going to be checked in by our awesome admin team. You know who they are, Jonathan and Chris. They're going to check you in, okay? Now, we're going to also give you a COVID screener. However, prior to you coming to the office, I told you earlier that we're going to be sending you things via your text or email. 2 hours prior to your appointment, you're going to get that text or email from us. And you have to fill that out. And you have to fill out all the questions. Every patient has to be screened prior to being seen by moi. Actually, by any dentist by now. Okay, so don't think you're going to say, oh, Dr. Freeman asked me too many questions. She all in my business. No, go down the street. They're going to do the same thing. Okay, so just understand. If you get this COVID screener from us, you have to complete it. Now, mind you, when you call to schedule your appointment, we're going to ask you those questions. And we're going to ask you again the day of the appointment. Because guess what? Things could change from today to 12 days from now. Right? You understand, right? You're welcome, Miss Bender. You know I love you. All right? Also, ladies and gentlemen, boys and girls, if anyone in your house has been sick within the last 14 days, please kindly reschedule. I don't care if it's a cold. If it's not, they're not tested positive for coronavirus, please, please, please reschedule your appointment, okay? Can you please do that for me? Do it for mankind. Thank you very much, all right? Also, when you sit down in our chair, if you pass stage 1 and you get back to the back with us, our clinical staff, we are going to have you rinse with the hydrogen peroxide solution. That's, it is what it is, okay? We're going to have you rinse with that. I don't care if you're coming for your braces checks, you're coming for your Invisalign check, if you're coming to get veneers, if you're coming to get your teeth cleaned, coming to get your teeth pulled, coming to get in the field, drilled, whatever. Every appointment, you are going to be rinsed. Not rinsed like that, but we're going to give you a rinse of a hydrogen peroxide solution. Hey, Mr. Bryant, all right? Understand, I'm giving you heads up so you're not looking like, what am I doing, okay? This is a new protocol. With all this in mind, understand your appointment time is going to be a little longer than before because these are steps that we have to take. All right? Understand that. So be kind with us as we are kind with you. My awesome team has been here all week getting ready for next week. Because if you know anything about me, you know I'm going to study. And the Bible says to study to show yourself approved. But we make sure that we are trained so we can treat you properly. Right? We are training our team that's from the admin staff to our clinical staff. Everybody knows what to do. So make sure that you are comfortable with us because we're comfortable treating you, okay? Also, if you don't complete these documents, it's going to make your appointment time longer. And if you are not like swift on your feet with electronics and your appointment time was an hour, and you're still completing those documents I sent you 2 weeks ago, an hour to the appointment, we are going to reschedule you, okay? I'm just telling you like it is, all right? Because we can no longer have people just congregating and hanging out. Meaning when you check out, you know how Jonathan and Chris love to talk, right? They love to get all into your business and how your mama doing, how your children doing. It's time to leave. It's time to go, okay? So no more congregating because, we have a good time in this Fremont dental office. We treat everybody like family, and we still going to treat you like family, but we're going to do it over the phone, okay? So understand when you check out, it's going to be a nice, smooth transition, all right? And if you see me from the back with my little broom like Sandman, I'm going to usher your tear right at the door like. I'm going to say bye. You got to go. Get up out of here. You ain't got to go home, but you got to get up out of here. But nonetheless, those are just a few things that we are doing differently here in the office to make sure that we are treating you differently. Now, I said there's two parts. Today is just part one of what to expect when you come, meaning what to expect, just the check-in, check-out procedure. We got a whole lot of stuff going on here that's different than before. But I'm proud to say that many of the new protocols that were set forth by our governor, CDC, ADA, OSHA, OSAP, we were already doing those. So we're already ahead of the game. So I want you all to understand that we're going to do something different next week when you come. Make sure that you know that. Press, save this video so, when you get ready to come here, you can replay it to refresh your memories, because Doc already told you what's going to go down, right? Check your documents, check your emails, check your texts from us, right? Make sure that you understand, come by yourself. We're not scary up in here. We like to have fun. So if you think you have to have somebody hold your hand, it's going to be one of us, because your mom and daddy can't do it anymore. Your sister and brother, your friend, whatever. We're still going to offer you the headphones and the nice music, and we're going to still do that. But we're going to make sure that we're all safe, okay? So I practice with faith, not fear. I'm not afraid of any of this. I know we're going to be all right. We're going to get through this. As I said, we're going to get through this. So make sure you are not afraid to come to the dentist because of the coronavirus. However, also, in Georgia, the stay-at-home order is still in effect for people 65 and older. So that's until June the 12th, okay? So make sure that you know that. Steve Jones, you say, can Chris hold my hand? Now look, I know y'all were roommates back in the day, but if Chris comes back there and holds your hand, it's going to be a problem. See this head right here? You already know I ain't playing with you. So anyway, let me go on back to what I was saying. The stay-at-home order is still in effect for people 65 and up. So we are definitely going to be rescheduling your appointment to after June the 12th. We are following the law of the land to make sure that you are safe. All right? So please understand. Do not be mad when you get that call from Christopher, Jonathan, Tia, or Laura about rescheduling your appointment. All right? We are following the law of the land to make sure that you are safe and healthy, okay? Whew, that's about all I have to say right this moment about that. But you're going to hear from me either tomorrow or Sunday or Monday, but definitely prior to Tuesday, so you can see what's going on in this office, things that we have installed, things that we have built, things that we have purchased that are all for your benefit and safety. All right? If you have any questions, ask me now. Andrea says, okay, so wait, you said children, my 9-year-old can come for an appointment. He can come for his appointment, but he can't come with you to your appointment. Does that make sense? There are no visitors allowed in the office. If you're being seen, they can't wait in the waiting room for you. Okay? No one can come into the building except for the person being treated. Okay, I hope that answered your question, okay? Are there any other questions? Come on, bring them out. If you don't have any right now and I think you have some later, by all means, you can put them in this video and I'll come back to it. You can send me an instant message, a private message. You can call the office, okay? 404-761-1659. We are here to answer your questions. Jonathan Sam says we need our teeth cleaned, shave, and you're right, okay. So make sure you call the office, Dianca, 404-761-1659, and make your appointment. If they're not here, leave a message. Trust me, we have a month and a half worth of appointments. We're rescheduling. We're not pushing anybody out unless they have to be pushed out. And look, don't feel bad if you don't feel comfortable coming right now. We will reschedule you, okay? We're not forcing you to come. Just know that it's a safe environment. But if you want to push it out, please, I'd rather you tell me you're going to push it out than just not show up, okay? okay? Because we have people who could take that appointment. Just call, say, hey, doc, you know what? I'm not really ready to come out right now. Can I come in whatever month? Fine, thank you. But I will be mad if you just don't show up. You know how it is, okay? I just want to bring him to you. Yes, I want to be his dentist too, Miss Banks, for sure. Yeah, good. All right, so I'm about to head out if there are no more questions. But if there are, like I said, always leave them in the comments. Call me, write me an email, send me a message, send a carrier pigeon. Whatever you got to do is fine. But we're about to head out of here. It's Friday afternoon. Y'all know it's getting ready to happen. I'm out of here. Bye, y'all. Have a great weekend. But please stay safe. Do not act like the coronavirus is gone. It is not gone. Stay your tail at home. I want to curse right now, but I'm not. I don't want to use the word tail right now. But keep that thing at home, all right? I love you much. See you soon. Bye.